don't get into sports medicine unless you're a huge sports fan, right? So, and obviously we take care of a lot of teams, but we also have a lot of athletes who live in the city of Atlanta. We have a lot of athletes that roll through Atlanta from visiting teams. So tell us a little bit about what your approach is when you handle the high-profile athlete. Have you ever been starstruck, like, I got so-and-so in my exam room today?
Yeah, I mean, when they're right there in the room with you and you're like, wow, like, I know this guy, like he's a big deal. You might be freaking out inside a little bit just because, but you got to stay calm. Like the calm is contagious, as they say. And so in order to stay focused, I remember like, yeah, it's just like everybody else. It's another player, another person, another athlete. They have their own questions and issues that we have to manage as their physician, and you just keep rolling through it. And you get to know them and you talk, and I think, again, it goes back to being the professional, right? How about you?
There's a level of experience that you have to have, right? I mean, as mentioned, when people find out I'm the team cardiologist for team X, Y, and Z in Atlanta, the first time, oh, that's so cool. There are layers of challenges there that we all signed up for whenever you take care of those little athletes. And again, it goes back to working with the management, the agents, keeping everybody informed, the communication. And again, it doesn't matter if I'm seeing the star of the team versus the last person on the roster. It's the same level of communication. That's a human being on the other side too. They're a patient and they want to be taken care of like everyone else. They don't want somebody walking in that's going to treat them differently. Not that you're going to do something inappropriate like, hey, can I take a selfie with you? No, I don't think anybody would do that. But like, you still take care of them like you would anybody else, and that is the critical part of things.
At times, out of nowhere, we'll see a news article or some situation will come up where there's a sudden cardiac issue in high school, college, professional athlete, whatever the case may be. And I was curious on your opinion as far as when that happens and people are looking at you, how do you approach that?
I think the most important thing is for everybody to understand that despite anybody being healthy, these tragedies can occur, like exertional hyperthermia, for example. So every year you'll see a case of a young athlete who gets pushed potentially too hard or just trains too hard in the middle of July or August in the deep south, and heat stroke. So there's all these things that can happen even to a young, healthy athlete. And so that's why anytime one of these cases occur, I always try to narrow the focus on the emergency action plan. And you've seen that with some cases over the last couple years. Which is that you can't prevent all these, no matter what you do. I don't care if you get an EKG, an ultrasound of the heart, a cardiac MRI, a CT scan, a heart cath, these cases will still happen. And that's why everybody should learn CPR. Understanding that the emergency action plan saves lives should be where we funnel really most of the resources up front. That's how you're going to save lives. Of course, you're always thinking of the family and the athlete, and we need to respect privacy. I think that's another problem now, which is the age of social media and everybody spitting out diagnoses when you have no idea what's going on. That's a whole separate can of worms. But just emphasizing, hey, let's give privacy, let's let things sort out, but we can still pitch an important message, which is that emergency action plan.
I agree with you. I think if you can, the first thing you can do, hit the ground running and make a big difference is like, hey, learn CPR, AEDs, what's the action plan? How do you get in touch with emergency services? That's why I think it helps people like me and you to kind of work with patients and be in the positions that we're in where we can talk to, medical directors and athletic directors of schools like, hey, you guys, need to allocate dollars to this, and talk to your local governments and Congress people to like push money into this, because it's unfortunately not going to go away, but I think you can certainly make a difference and decrease the amount of deaths and issues that happen.
What's the best piece of advice you've ever gotten in your career, kind of getting up to this point, and what piece of advice would you give maybe to the resident or fellow who's working with you that wants to be the next Dr. Brandon Mines?
The best piece of advice I had was, you had mentioned it, treat all your athletes the same. Have open lines of communication, obviously staying current on all the medical things, but sports is complicated, because of the athlete. There's so many factors involved with their performance and mental health, and you want to have good communication skills. You have to listen, you have to not talk and just listen, and then you want to acknowledge what their needs are, and then let them know, like, you have to exude that I'm your doctor, like I'm here for you. And for the young professional trying to get into it, they gotta keep that part in mind, make sure that they make proper connections and get the experiences in their early training to show that they have that level of interest. Work with high schools, start an interest club for something in sports that you like show that you have an interest, because if you actually have an interest, then you're gonna make a good doctor for these athletes we eventually take care of.